Hi, I'm Malathi, Assistant Professor, Child Health Nursing and College of Nursing. Today we are going to see about the protein energy malnutrition. What is meant by protein energy malnutrition? In the statistics shown the protein energy malnutrition in the sense India has the highest number of students stunted kids with the 46.6 million children who are stunted. India tops the list of the countries, followed by the Nigeria. 13.9 million people have affected by the stunted. The stunted in the sense. Hi everyone, I'm Malathi, Department of Child Health Nursing, occurred in ES College of Nursing. Today we will see about the cerebral palsy. In cerebral palsy in the sense, little disease or known as statistical encephalopathy is called as cerebral palsy. The meaning of cerebral palsy is started in the year of 1860. A cerebral palsy is known as little disease. A statistics encephalopathy named after a English surgeon Wilson Littlejohn. In this Wilson Littlejohn as an English surgeon, they only find some difference of cerebral paralysis of the children's. That only have to develop the framing of name as little disease. The Wilson Littlejohn is developed by the forming of cerebral palsy is called as otherwise known as little disease or otherwise statistics encephalopathy. Name after the English surgeon will be Wilson Littlejohn. And the meaning of cerebral palsy is derived from the Latin word cerebrum, a cerebral affected part of the brain, and palsy, lack of muscle control. In the cerebral palsy is the part of brain affected. Your part of brain have to affected, and involuntary muscle movement is called as cerebral palsy. For example, a villain movie, abnormal movement have developed by your body is called as cerebral palsy. In this Ajit sir have to shown the some of the difference of body parts like walking and smiling, and they have to speech in this different type of activities of involuntarily, that is called as cerebral palsy. For example, for this movie also. And incidence and prevalence of cerebral palsy in the sense, prevalence of cerebral palsy, every 1,000 live birth and two of them affected by the cerebral palsy. Prevalence of cerebral palsy is increased in the low birth weight infants less than 1,000 grams. If cerebral palsy may develop the baby getting a decreased amount of weight, in the sense the normal weight is 2.5 to 4.5 kgs. If the baby is born with less than 1,000 gram, may develop the cerebral palsy. A twin baby have to develop by the cerebral palsy. This is the main incidence and prevalence of the cerebral palsy. Next we comes under the etiology of cerebral palsy. In this etiology, caused by developmental, genetic, metabolic, ischemic and infections. In this genetic and metabolic, ischemic and infection is have to divide into three parts: antenatal factors, intrapartum factors and postpartum factors. In this antenatal factors, 80% of may affect at the main etiology. In this intrapartum 10% and postpartum is 10%. First we will see about the antenatal factors. In this antenatal factors, 80% of affected by the infections: German measles, diabetes, toxemia of pregnancy, preeclampsia, RH incompatibility. This is the main cause and main reason for baby have to affecting the cerebral palsy, that is infection, German measles, diabetes, toxemia of pregnancy, preeclampsia and RH incompatibility. In intrapartum, asphyxia and birth injury, prematurity also developed by the cerebral palsy. In postpartum is 10%, very high fever, brain infections, head injury, lack of oxygen, poisoning, intracranial and hemorrhage of blood clots. And next we will move on to the classification of cerebral palsy. In this cerebral palsy have to divided by the two classification, extrapyramidal and pyramidal. In this extrapyramidal classification, in the sense, digynate dikinetic, it is non-spastic cerebral palsy, and ataxic in the sense non-spastic cerebral palsy. In pyramidal, spastic cerebral palsy have to comes under the classification. Next we will see about the spastic cerebral palsy. Look like legs is called as scissor-like or cross-like position in the leg, have to walk and stand, and this is called as a spastic cerebral palsy. And for looking this picture, legs look like crossed, and like scissor. In the sense, this is called as spastic cerebral palsy. If the baby is walking or have to stand, in the sense the legs are combined together, in the sense crossed together, have to developed by the, it's called as spastic cerebral palsy. And based on the affected limb, in this type of cerebral palsy, in the sense the four main category have to divided into four types. Monoplegia. In this monoplegia, in the sense affected only limb, usually on arm. Only one side of arm have to developed by the paralysis. That is called as monoplegia. And hemiplegia, in the sense half of the body parts. In the affected one side of the body parts and leg, trunk and arm is called as hemiplegia. If the patient is getting hemiplegia, in the sense half of the body have to developed by the unresponsive or unwanted movements, or not cooperating the muscle tone. Okay. In this dysplegia in the sense affected either the both arms or both legs. Of the quarter part of the body parts have to affected by the palsy. And quadriplegia, in the sense affected all four limbs. In the sense the patient is prolonged bedridden, or patient have to developed by the full affected body parts is called as quadriplegia. Next one is clinical manifestation of spastical cerebral palsy. In the sense, have to see the clinical manifestation of spastic cerebral palsy. In the sense, first we have to see the first image of baby have to hold the hands. That is atonic cerebral palsy. Must be differentiated from other cause of floppy baby syndrome. May show variable degrees of improvement or progress to orthoid and spastic stages. This is the atonic cerebral palsy. And next one is hemiparesis on right side. The child is getting a one side of hand is glass, no, that the image is hemiparesis on right side, hip and knee and contracture and talipes euchians. And next one is spastic quadriplegia. In this spastic quadriplegia, we already said the cross-like position, a scissor-like position, the position lower limbs due to addicted to spasm. This is the spastic quadriplegia. And diplegia is a lower limb more affected, contracture of hip and knees and talpia equinaris. That is club foot, as otherwise called as club foot, also have to set. And orthoid and persistent asymptomatic tonic reflex has also one hand and one leg is have to flexed, other hand and leg is have to extended. That is the asymptomatic tonic reflex of spastic cerebral palsy. These are all the main clinical manifestations. And next one is archoid and dyskinetic cerebral palsy. In this archoid dyskinetic cerebral palsy, in the sense fluctuating tone involve the abnormal involuntary movement that disappear during a sleep and increase with the stress. The abnormal involuntary movement have to developed by the normal active movement and normal active state. If the baby is getting sleep, in the sense the movement have to absent, the disappear have to that particular movement. If the baby is getting more stress or more anger, in the sense the signs and symptoms have to increase in this involuntary movement. Interferes with the speaking, feeding, reaching and grabbing and any other skills, in the sense have to some developmental ability to cope up. And 20% of the CP cases have to detected by the archoid or dyskinetic cerebral palsy. Ataxic cerebral palsy, in the sense poor balance and lack of coordination. By the child is walking, while the child is coordinating with the one, taking the one glass, taking any books or taking any one kind of things, is poor balance to lack of coordination. In the sense, high coordination or hand coordination or leg coordination, in the sense the coordination will be disappear. Wide based gait, adept perception usually affected. Tendency to fall and stumble, and inability to walk straight line. In this, if we check the normal growth and development, in the sense we have to check the fine motor. A baby, in the sense you have to walk one line, you have to jump, you have to run, in the sense you have to check the grasp and fine motor. If the ataxic cerebral palsy baby have to fell down the inability to walk on a straight line. Least common is for 5 to 10% of cases have to affected by the ataxic CP. In this ataxic CP cerebral palsy, in the sense have to walk with a not a straight line, some flexibility, some changes have to walk in this ataxic cerebral palsy. And ataxic cerebral palsy, clinical manifestation is physical sign, a poor head control, stiff or rigid arm or leg, pushing away or arching back, and floppy or limp body posture, cannot sit up without support by 8th month. If this, the not growing development is this bone development. Use only one side of the body or only the arm to travel. And then clean hands after 3 months, leg scissoring and seizure, sensory impairment. In the sense, hearing, vision have to affected, and after 6 months of age, persistent tongue thrusting have to occur. And behavioral sign, in this behavioral sign, in the sense extreme irritability or crying, feeding difficulties, little interest of surrounding, excessive sleeping. And other manifestation, in the sense lack of movement and involuntary movement, lack of coordination also may have to develop. Feeding and eating is difficult to coordinate, and learning capacity and capability is decreased, may develop the seizure, and poor behavioral pattern, poor communication pattern, and poor the nutritional pattern also have to other clinical manifestation of CP. In this diagnostic evaluation, in the sense cerebral palsy of diagnostic evaluation, posture criteria. In this posture criteria, in the sense, P means posturing, abnormal movement. We look like a baby or child is looking like a abnormal way. And oropharyngeal problem, in the sense tongue thrusting and swallowing abnormalities. Oropharyngeal, in this oral problem have to develop in the tongue thrust and swallowing abnormalities to be detected by the main diagnostic evaluation. And then strabismus and T.S. tone, hyper or hypotonia have to present. In this, E means evaluational maldevelopmental problem have to develop, and reflexes, increased deep tendon and reflexes, persistent Babinski reflexes have to develop by the posture. P means posturing the abnormal movement, and O means oropharyngeal problems, and S means strabisms, and T means tone, and E means evaluation of maldevelopment, and R means reflexes. And neurological assessment have to developed by the MRI, magnetic resonance image, and computerized tomography scan to identify the area of brain damage. And the EEG have to develop electroencephalopathy, where small electrodes are placed on the scalp to monitor the brain activity. And electromyogram and nerve conduction study to testing the electrical activity of muscles and the measure the conducting a function of nerves. And laboratory studies to detect any blood clotting and screening for genetic or metabolic problems. And additional tests is vision impairment, hearing impairment, speech delay of impairment, and intellectual disability, other developmental delay movement disorder have to develop. And medical management of cerebral palsy. A main aim of therapy is cerebral management is to establish locomotion, communication, and self-help. Have to increase the baby to establish locomotion, communication, and self-help. To gain an optimum appearance and integration of motor function, to correct the associated defect as early and effectively, to provide education opportunity and adapted to the individual child needs and capability, to promote the socialization experience with other unaffected children. To physical therapy have to provide, use the orthotic device such as crutches, casting and splint to support and improve the walking. Occupational therapy also you have to provide. Adaptive equipments may include walker, quadrupedal sconces and seating system of electrical wheelchair have to provide for the occupational therapy. A speech and learning therapy. A speech language pathologist can help to improve the children's ability to speak of cerebral palsy or to communicate using single language. Bilingual or single language have to used by the speech language to giving a speech therapy. And then recreational therapy. The therapy can be help improve your child motor skill, speech and emotion well-being. And pharmacological treatment have to cerebral palsy in the sense the goal of drug therapy is to reduce the effects of cerebral palsy and prevent complication. Analgesic drugs to reduce the intense pain or muscle spasm. Inhaled nitrous oral midazolam used for the sedation during the botulinum toxin A injection. And then tantalum sodium and then baclofen and diazepam and improving the muscle coordination and to the muscles reflection. Anticonvulsant drugs to relieve or stop the seizure. Administration of botulinum injection. A botulinum toxin type A used to reduce the spasmatic in the target muscles of the upper and lower extremities. The surgical treatment of cerebral palsy used to correct a problem with bone and joints by lengthening any muscles and tendon that too short and causing the problem. Orthopedic surgery. Orthopedic surgery may be required to correct the contracture or spastic deformities, to provide a stability for an uncontrolled joint, to address bone malignment and to provide a balanced muscle power. Example for orthopedic surgery: tendon transfer, muscle lengthening and spinal deformities. And selective dorsal rhizotomy. In selective dorsal rhizotomy is a surgical procedure that can be help the children with particularly severe muscle stiffness in their legs to improve their walking. And gastrostomy. The surgery may performed to improve the feeding, correct the gastrophageal reflexes, disease and correct associated dental problem. Have to gain the dental problem. Gastrotomy tube placement have to give a feed to the baby. And I have to refer this content of Parthasarathi and Wong's. A cerebral palsy awareness day is October 5 is the cerebral palsy day, and blogging for hear of cerebral palsy. Thank you.